Better Start Point, or BSP for short, allows any medical support assistant, the MSA, to obtain an accurate pre-triage history. BSP results help guide the registered nurse in the determination of a callback priority. The registered nurse can use the priority score and/or symptom combination to determine which patients should be evaluated first. So let's get started. First, ask the patient why he or she is calling. The key here is we're looking for symptoms such as back pain, ear pain, headache. In this first example, let's say the caller tells you he has a sore throat. In the Begin Typing to Select Symptom area of the screen, go ahead and type in sore throat. Sore throat will then be visible in the menu set. Select sore throat. This will automatically add sore throat to the selected symptoms on the right-hand side of your screen. As you can see, a drop-down menu opened under sore throat. A text term prompts you to ask if other symptoms are present. The symptoms listed are by priority and should be asked in order from top to bottom. Symptoms listed are considered a better start point for telephone triage and also a way to communicate other symptoms the patient is having to the registered nurse who will be performing telephone triage. What I'm going to do is ask my caller if they're having any breathing difficulty. If he says yes, I select breathing difficulty to add it to my selected symptoms on the right-hand side of my screen. I then ask if he's unable to swallow. If the patient on the call denies one of the symptoms, nothing more needs to be done. I've now added sore throat and breathing difficulty to my selected symptoms. I'm ready now to copy and paste this information into TRM Plus for my nurse to review. How do I do that? Select Done, and the Better Start Point results screen will open with a copy the following to comments. We've already highlighted this section for you to make it easy, so all you have to do is copy this information by either using a Control-C or right-hand mouse click to copy the information however you do that. So I copy that information and then I select Finish. What I'm now doing is when I select Finish, I then return back to my TRM Plus screen and I paste that text into the comments section. You'll then follow whatever procedure you do to suspend the note or to communicate to the nurse that they have a priority 1 patient waiting for them in their queue. So let's go ahead and try another one. This time, let's say the patient has a loss of appetite. I simply will click in I have to spell loss of appetite. I select loss of appetite to add it to my selected symptoms. And again, a subset of symptoms opens, and I'm going to ask the patient if they're experiencing any abdominal pain. Do you have diarrhea? Patient says yes. Have you been vomiting? Patient says yes. And have you had any weight loss? And the patient denies. So my selected symptoms for this particular patient is loss of appetite, diarrhea, and vomiting. I now select Done. Again, I am able to copy this information. It's already highlighted for you. Go ahead and copy this information. Select Finish and return back to TRM and paste that text into the comments section and follow your usual workflow. So let's do one more. Let's say this patient calls that they're experiencing dizziness. I'm going to go ahead and type in dizziness. All I have to do is type in DIZZIN. Dizziness will appear in my menu set. I want to add it to my selected symptoms. I merely select it and a subset opens up So I'm going to need to ask the caller if they're having any breathing difficulty. If they answer yes, I want to select it. If they answer no, I move to the next one. Any chest pain? Have they passed out? Let's say they did. So I'm going to select passed out to add it to my selected symptoms. I'm going to ask if they have palpitations or excessive sweating. So I've now selected dizziness and passed out. I select done. This will indicate to the nurse in TRM Plus that this patient is a priority 1, has complained of passing out and dizziness, and denied the breathing difficulty, chest pain, palpitations, and excessive sweating. Again, I copy and paste this or copy this information. I select finish. I go back into my TRM. I paste that into the comment section and complete my workflow to give it to the registered nurse. So what do we do if the patient calls with some multiple symptoms and you're not quite sure what to select? Let's say the patient calls and they have both a sore throat and diarrhea. I could go ahead and type in sore throat, select sore throat to add it to my selected symptoms. I'm going to ask if they're having any breathing difficulty or inability to swallow. If they answer no to both of those, I don't need to do anything else, but they've also had diarrhea, and I wasn't sure if I should use sore throat or diarrhea. What you can do is go back before selecting done is go ahead and type in diarrhea, and I'm going to ask if they're experiencing any abdominal pain, and let's say the caller says yes. I select abdominal pain and it automatically adds it to my selected symptoms. When I select done, both of my symptoms that the patient had abdominal pain and diarrhea and sore throat will be there, but the patient denied the other symptoms. I again copy that information, I select finish, and I move back over to TRM Plus and paste into the comment section and complete my workflow. What happens if you select a symptom in error? Let's say we go into the patient with a loss of appetite, and I ask if they're having abdominal pain, and they deny it. But I accidentally select it, and I added it to my screen. To remove any symptom from the selected symptoms, simply select it, click on it, and it will be removed and added as a denies into the term. So that is how Better Start Point can be used to help provide back to the registered nurse a priority score and or symptom combination to determine when the patient should be evaluated. Thank you for your time, and I hope you enjoy the solution. Thank you.